As far as azacitidine and magrolimab, so this was actually one large trial. I just spoke about the higher risk MDS trial, but separately we enrolled acute myeloid leukemia patients. And early on, we saw some encouraging efficacy. And really simultaneously, HMA venetoclax, which of course has transformed the treatment of elderly AML, has really not improved outcomes in this patient population. The survival is actually identical to what it is with single agent hypomethylating agent. The median survival is about 6 months. So very early on, we amended the study to only enroll P53 mutant patients. And so my close colleague, Dr. Daver, presented data at ASCO and EHA in 72 patients that have P53 mutant AML. Again, this is the highest risk group of patients, very sick at baseline, very severe cytopenias. So again, the tox profile is quite similar. There's this on-target anemia that we expect with azacitidine and magrolimab. But again, no really unique toxicities. There was at 60-day about 18% of patients that died. Again, this is quite reflective of this patient population. It's actually over 20% if you look at HMA venetoclax combinations. But again, when we look at response rate, the composite CR rate is around 50%. And again, responses by itself are not the most relevant biomarker for our patients. It's really the duration of response and ultimately the overall survival. So the remissions have appeared more durable, and the median overall survival approached 11 months. Again, we still have a long way to go with these patient population, but again, that's close to double what we expect with either HMA or HMA doublet combination therapies. Again, at this Congress, we present some early transplant data. The cohort is relatively small, but there's a clear separation with the median survival not met in transplanted patients. And I think what's more relevant is historically the transplanted P53 mutant patients do very poorly, some centers even arguing whether or not they go to transplant. I think one big question in this trial is what was the molecular level of response in that group. We do see in patients that achieve remission a high degree of clearance, or at least less than 7%, which was the sensitivity of the whole exome sequencing done in this study. So I think there's some interesting future analyses to be done, but this trial also supports the ongoing randomized phase 3 trial called the ENHANCE-2 trial, which is an open label trial of HMA magrolimab versus HMA venetoclax or intensive chemotherapy, which is relevant in that this is sort of the first independent AML study. So it's not age, it's not fitness, and so we're quite excited to see these data going forward.